On the steps of Alberta's legislature, a crowd of 200 made their concerns known. Bill 207 is a proposed piece of provincial legislation that would let doctors refuse patients based on personal beliefs.
We're here for patients. We have a responsibility and an ethical code, and I think that's what we stand by first.
This bill is aligned with
It's only past first reading, but it's already attracting attention and raising concerns Canada-wide.
I think it's a big story on many fronts. If this is pursued, it then takes us in the direction of healthcare workers are in a position to essentially make value and moral judgments related to the choices of their patients. And you know, in Canada, that is not something that we do.
The bill was introduced by Dan Williams, an elected MLA with Alberta's United Conservative Party. He says existing protections that give medical professionals the right to opt out of services they don't believe in don't go far enough, because healthcare providers are required to make referrals. That requirement was challenged in Ontario by the Christian Medical and Dental Society of Canada, but an Ontario court upheld the rule.
We now see a regime that I believe is incredibly aggressive towards conscientious objectors. Many of them are reaching out saying, don't let this happen in Alberta as it did in Ontario.
Dying with Dignity Canada believes that this is the biggest attack on medical aid in dying since it was legislated in 2016.
The advocacy group Dying with Dignity says access to medical assistance in death is already challenging in Alberta. Patients being treated at facilities operated by Covenant Health in Edmonton must transfer to a different hospital before receiving the care. Bradley Peter believes this bill will only make access issues worse.
This is the type of behavior that Bill 207 encourages. It encourages facilities, it emboldens them to continue to force people out of hospitals at the end of life.
But it's not just assisted death services at risk. Patient advocates fear access to things like abortion, birth control, and LGBTQ2 medical services will also be impaired.
If you do not refer, if you simply refuse and do not refer, then you are limiting access.
But it's whether the rights of patients will trump the rights of providers that's now the question, one that will be answered in the Alberta legislature in the coming weeks. Heather Yourex-West, Global News, Calgary.